Our program over the last 3 years has been called EPICC, which stands for Engaging Patients in Care Coordination, and it uses peers to do rapid post-overdose response. That can be in the hospital, or that can be following an overdose that EMS has outreached. So we received expansion funds from Department of Mental Health, and if first responder outreaches someone in the community and doesn't transport them to the hospital, we can also send a peer out into their home or community. So over the last 3 years, we have served nearly 5,000 patients now. Our estimated original target was about 250. So as everyone has echoed, like, the problem isn't going anywhere. The issue is still here and it's still rampant. And I would echo what everyone has said, and just from our perspective, being able to do increased outreach post-overdose is important. I think the utilization of peers is important. And then, of course, as many have said, we are very fortunate. Our partner treatment agencies reserve spots for us, slots for patients the next day or within 48 hours. However, for the rest of the population, I know that that's not the case. And even for some of our partners, to receive methadone might still be a 2 or 3 month wait. To receive buprenorphine, you might still be sitting for 10 hours. That's a long time when you're sick. If I had to sit for 10 hours in the ED, I would not be a happy camper, right? Like, we are accustomed to quality medical care, and using the same system that's been around for decades, and we haven't seen a decrease in this issue in decades, is questionable and concerning. So I hope that we continue to fund rapid access medical care, which might mean partnering with CMHCs or FQHCs, primary care, integrating it into regular care that you would receive with any physician, not putting it on the backs of a very limited number of centers. And I think also, to echo research and evaluation, using appropriate outcome measures that determine funding. So this is kind of upcoming across the country, that where funding goes, funding should follow outcomes. So I think really ramping up efforts to make sure that what we are doing is benefiting the community. And like you mentioned, I work on data points, and so we've served 5,000 patients. Great, but that one patient is who we're aiming to help, right? So 5,000 sounds really big, or the opioid epidemic, it sounds huge, but it's that one individual person. Like, that's the outcome that we want to see, is them surviving, and not only surviving, but thriving down the road, which I think after getting them medical care is where, and/or during, is where peer supports come in and housing come in, and making sure that long-term they have the support to build a life that they are proud of and happy with, that they deserve.